open and free feel to ask a question one by one during the lecture or after the lecture. If you had any doubt, please raise a hand and ask a question. So, without wasting time, we are moving. During the pregnancy, there is a progressive anatomical and physiological and biological changes takes place not only in genital organs but all system of the body. I am mute all the members at present, so there will be no disturbance during the lecture. Okay? So, whenever you want to ask a question, unmute yourself and can ask a question. During the pregnancy, there is a progressive anatomical, physiological and biochemical changes takes place not only in genital organs but all system of the body. Before moving to the physiological changes in the pregnancy, we have to certain knowledge regarding the anatomy of the female reproductive organ. This figure I can't explain you in detail because this all have to remember the name. So, in later on, I will provide this PPT presentation whoever wants it. So, you can refer it later on. The gross structure are, you have to recognize. First is prepuce, clitoris, labia majora, labia minora, vaginal opening, urethral opening, hymen and anus are main points you have to remember. Here is little bit inner about the muscular structure, but if you don't want to remember, it will be okay. You have to remember at least external genitala. This is the internal genital organ where uterus cervix in the middle of the position anteriorly bordered by the bladder and posteriorly by the rectum. So, uterus cervix with whole vaginal wall is sandwiched between the bladder anteriorly and the rectum posteriorly. This figure is important to know because as the pregnancy advances, there is a compression effect from on the bladder as well as on the rectum occurs, and this will give rise to the certain changes. So now moving for the physiological changes during pregnancy. What are the changes? This is very important to know because moving to further any in the diagnosis field, you should have as a consultant differentiate between what is normal and what is abnormal. So you have to differentiate which is physiological and which is pathological. So if you understand the normal physiology properly, then and then you can understand the pathology. So in subsequent lectures of this series, you will understand properly. If you understand these physiological changes, these are the normal things. So you would not mistake between the physiology and the pathology. Vulva. Vulva is edematous and more vascular. So if you see the vulva of the pregnant ladies, it gradually increase in the size, become edematous and more vascular. Labia minora are hypertrophied. Second is vagina. Vaginal wall becomes edematous, more vascular, and length of the anterior vaginal wall increased. As the pregnancy happens, as the implantation of the embryo happens, the birth canal, the canal from which baby has to pass. So, vaginal wall is preparing for itself for the birth of the baby. So, length of the anterior vaginal wall is increased. Third one is uterus. Uterus is most important organ that going into the major change. Increase in the weight, increase in the capacity and increase in the length. Non-pregnant uterus weight is 60 gram. That increase up to 1 kg at a term. So much increase in the weight. 60 gram to 1 kg. Cavity from 5 to 10 ml to become 5 liter. Here it's a writtenly typed, not 5 ml, 5 to 10 ml may say 5 liter. Length is 7.5 centimeter to 35 centimeter. So, such of changes occurs in the uterus. Increase in the growth and enlargement of the body of the uterus. There is a hypertrophy and hyperplasia of muscles, stretching of muscle fibers, increase in vascularity. So, these are changes takes place in the uterus. Uterus increase, there is a hypertrophy and hyperplasia of uterine muscles, increased weight of the uterus, increased capacity of the uterus and increasing length of the uterus. The most important thing we have to remember is Braxton-Hicks contraction. What is Braxton-Hicks contraction? Uterine contractions, those are irregular, infrequent, spasmodic and painless without any effect on the cervical dilatation are called Braxton-Hicks contraction. So, because of certain changes develops as the pregnancy develops, there is a spasmodic irregular contraction develop in the uterine muscles. So, when you are examining the patient, you may feel that contraction, but patient is not aware of it. That are called Braxton-Hicks contraction. The difference between Braxton-Hicks contraction and the labor contraction, you have to differentiate. First, Braxton-Hicks contraction are painless and irregular, infrequent, not associated with cervical dilatation of the cervix. Where pathology means labor contractions are regular in a rhythm at a interval, fixed interval and associated with gradual dilatation of the cervix. And patient feel excruciating pain. Here patient is not feel the pain. You can feel Braxton-Hicks contraction from the 12 weeks of the pregnancy and any time during the consultation. Cervix. There is a hypertrophy and hyperplasia of the cervical gland. There is a marked softening of the cervix, that is called Goodell sign. Because of hypertrophy and hyperplasia of the cervical glandular muscles, cervix also feels soft when you do the bimanual vaginal examination, that is called Goodell sign. Breast, best evident in a primigravida. There is an increase in the size, hypertrophy and proliferation of the ducts and alveoli. Nipple and areola are enlarged, erectile and the pigmented. Once the patient is become pregnant, you can see small pigmented tubercles around the nipple on the areola that are termed as Montgomery's tubercles. These are the signs of pregnancy. Milk secretion, like a watery secretion, is started from the 12 weeks of the pregnancy. Breast, duct and alveoli are preparing food for the baby. So, preparation is started from the 12 weeks of the pregnancy. That's why most evident in the primigravida where breast, duct and alveoli undergo the hypertrophy and the proliferation. Skin. On the skin, on the face, there is a chloasma gravidarum. You can see butterfly-like pigmentation on the cheek. That is called chloasma gravidarum. So, what happens when sometimes patient comes to you and they tell that I have black pigmentation on my cheek. you may consider it as a pathological, but if you know this physiological change, then you can say it's a normal physiology. That's why this is the importance of why physiological changes you should know before moving to the any pathology. Then the abdomen. On abdomen, there is a linea nigra and the stria gravidarum. What is linea nigra? Linea nigra is a black color pigmentation due to melanin deposition from xiphisternum to the pubic symphysis. It gradually become increase in the size and get pigmented as the pregnancy advances. So clear cut black belt seen, you can see from the umbilicus or maybe extend from up to xiphisternum to the pubic symphysis, that is called linea gravidarum. What is stria gravidarum? You can see the stretch marks due to mechanical stretching of the skin. There is a stretch mark production on the skin. So, it gives rise to the stretch mark. To reduce it, you can apply vitamin E oil from 4 months, means from 16 weeks of the pregnancy, from downwards to upward, to reduce the mechanical stretching. But you can't prevent these stretch marks. Then the weight gain. This is most important criteria. A normal pregnancy weight gain is ideally 11 kg. But it also depends on the BMI. If the BMI, patient BMI is low, like if BMI is less than 19, then weight up to 18 kg is normal. And if BMI is very high, then weight up to 7 kg is also okay. But for average people, weight gain should be 11 kg. So how weight increased? In first trimester 1 kg, second trimester 5 kg, third trimester 5 kg. So this way weight increased, and 6 kg is due to reproductive organs and 6 kg is due to pure maternal itself. 6 kg contributes from fetus, placenta, uterus and amniotic fluid, while due to altered osmotic pressure, body water metabolism, water retention, so 6 kg contributes to the maternal body weight. Why weight is very important for pregnant ladies? Because if there is a sudden weight gain more than 2 kg in a month or more than 500 gram in a week, that suggests patient is going into the preeclampsia. Preeclampsia is a condition where blood pressure is raised and it may adversely affect the health of the mother and the baby. And if the weight is very low or stationary or not increasing, then you may suspect the IUGR baby, that is the intrauterine growth retardation of the baby. So, at this point, only by measuring the weight, you can assume the future complication and you can advise investigations accordingly. As we discussed, body water metabolism is altered. There is a retention of the fluid. Pregnancy is a hypervolemic condition. Polyuria is very common in first trimester due to change in the osmotic pressure. So, polyuria is most common in first trimester and in third trimester. First trimester due to osmotic pressure changes and in third trimester due to bladder compression. So, when any pregnant lady presenting to you with symptoms of polyuria, first you should rule out whether it is not due to urinary tract infection. If it is not associated with urinary tract infection, then this could be the physiological polyuria. You can differentiate just by doing urine routine micro. If not infected, then it's a physiological changes of it. So, this is the importance to know physiology. Hematological changes, same. Blood volume is markedly raised, plasma volume is markedly raised, and pregnancy itself is a hypercoagulable or hemodilution state. Here, blood volume increased, plasma volume increased, but RBC and hemoglobin are in the same amount. So what happens? You take a glass of water, add some salt and sugar and make a sharbat or add lemon. You transfer into another glass, you add nothing but you add more water. So that drink will be diluted like form. Pregnancy is the same thing. Here there is a hemodilution. So there is always iron deficiency anemia develop if you don't care. WBC 8,000 to 20,000 at the time of labor. Here 10 is missing, not 2,000, 20,000 you have to read in labor. So neutrophilic leukocytosis is common in a pregnant state. So whenever you see 15,000 count in the pregnancy, and if only it is neutrophilic leukocytosis, don't worry, it's a normal physiology. You don't need to give and rush for antibiotics if you find count high, but it should be neutrophilic leukocytosis. Total protein is increased and AG ratio is decreased. So this explain why protein powder is to be given in the pregnancy. ESR is high, fibrinogen is high, and there is a gestational thrombocytopenia. So what is this? ESR high. जब ESR high है तो आपको ऐसा नहीं सोचने का है कि it is due to tuberculosis, rheumatoid arthritis. ESR high is common in normal pregnancy. Fibrinogen high is normal in pregnancy. Gestational thrombocytopenia, what is that? Normal platelet count is 1.5 lakh to 3 lakhs. But here, in certain cases, when the platelet count falls, it is generally falls in any viral infection, dengue, but due to pregnancy itself, platelets can be down. It all considered as a normal physiology. I am going repeat little bit fast as 3:30 is the main demo class of my obstetric course. So, I am again request all of you who have joined earlier, you have to log in again after 5 minutes, because after within 5 minutes this meeting will going to end. Real जो है demo class, it will start at 3:30 p.m. So if meeting is interrupted suddenly, you have to log in again. It's my request. Please join again at 3:30. It is the previous lecture is going on. So don't worry who had joined later on. 3:30 is our main demo class. In CVS, cardiac output is increased. Blood pressure is decreased by 5 to 10 millimeter of the mercury. So, in pregnancy, if the blood pressure is reduced, in second trimester, blood pressure is generally you feel in a lower side. It is due to postural hypotension. Patient will tell, if I am changing my position from the supine to standing, I feel the vertigo. It's a normal phenomena. You can explain them. Drink any sugared drink or hot coffee. Physiological edema. It is due to pressure exerted by gravid uterus on the common iliac vein. Because as the pregnancy advances, what happens? Gravid uterus will compress. So there will be the pressure on the common iliac vein, and this leads to the alteration in the lymphatic system. So physiological edema is there. You have to differentiate physiological edema from the pathological edema. Pathological edema in pregnancy are usually due to anemia and hypertension. It could be because of cardiac and the kidney disease, but here we are talking mainly about pregnancy. So you should normally worried about the anemia and the PIH or hypertensive tension. So physiological edema, typical presentation, it is relieved with rest. आराम करने से it will gone. But if pathological edema, it will not relieved with rest and it is painful. Thus, you can differentiate physiological edema from the pathological edema. As we discussed earlier, total iron requirement is increased. Pregnancy is a hemodilution condition. So, that's why there is always drop in HB level. When you compare two patients, one patient is not taking any iron supplementation and one patient is taking iron supplementation. At initiation of pregnancy, both HB are 11 gram. And at a term, if you see, those who don't have taken the iron supplementation, HB will drop to 8 to 9 gram. Where those who had taken the iron supplementation, it will remain 11 gram. So, that's why iron supplementation is required in the pregnancy. Bladder mucosa is edematous, so there is an increased frequency of urination. Alimentary system, common due to compression on the stomach, there is a dyspepsia, means acidity are very common. So, advise the patient to eat at a very frequent, small in quantity at a different intervals. So, this reduces the dyspepsia. Fourth is endocrinological changes. Here explains why progesterone is important in the first trimester, as what happens as during the day 2 of the cycle, follicles develop. Once the ovulation happened, that follicle convert into the corpus luteum, and that corpus luteum will secretes progesterone daily that support the developed embryo. So, it is the importance of progesterone, and this function is taken by the syncytial trophoblast, means a part of placenta. After 12 weeks, corpus luteal function will taken up by the placenta. So, then placenta is secretes the hormone to nourish the baby. So, up to 12 weeks, in case of misabortion, in case of repeated pregnancy loss, we provide the progesterone. Thyroid, there is always hyperplasia of the gland, iodine falls and increased intake of the iodine. So, always make a habit to do, that will come into my lecture, what investigation you are going to prefer in first antenatal visit. But thyroid status is very important to do in pregnancy. Why? Because it is correlated with the IQ, intelligence of the baby. Sometimes in the class we see one child is very high IQ and some are very low. So it could be due to subclinical hypothyroidism, because in pregnancy always affect the thyroid level. So subclinical hypothyroidism are very common. So in pregnancy always carry out thyroid status, and according to you have to advise them. This all investigations come in our subsequent lectures. So here I am completing my previous lecture, means yesterday those who had missed, that is for those. Now the main demo class is going to start 3:30, means now I am stopping this lecture. Those who are interested for the demo class, that is on confirmation of the pregnancy, various taste and methodology for confirmation of pregnancy, please, I am ending this meeting. You all people have to again log in and then we will start our demo class. Thank you. Please re-log in again by same link. I am ending this meeting. Okay.